Thank you everyone for joining us today. My name is Ariel Delaney, Deputy Director with Rotary Malaria Partners. Today's webinar is part of an ongoing series aimed to engage Rotarians as well as the malaria prevention community on unique topics of interest made accessible to everyone. Rotary Malaria Partners' mission is to ignite a global campaign for Rotarians across the globe in the fight to eliminate malaria. I encourage you to check out our past webinars in their entirety on Rotary Malaria Partners YouTube. Our moderator for today's webinar is Dr. Dorothea Chodu, CEO of Pilgrim Africa. Pilgrim Africa is a faith-based nonprofit engaged in malaria control, malaria education, advocacy, and operational research on malaria control in Uganda, a country with the 4th highest malaria burden in the world. Dorothea is a scientist and a Rotarian. She got her doctorate in physical chemistry from the University of Washington and did modeling work on HIV-1 RNA before attending Johns Hopkins Bloomberg School for a degree in public health. She has been a Rotarian since 2014 and a Rotarian Malaria board member for 6 years and is now a very active RMP ambassador. During the decade that Dorothy has worked for Pilgrim Africa, she has led and shaped the organization's engagement in malaria. Pilgrim Africa specializes in implementing malaria control in rural, highly endemic areas and on discovering best methods of reducing high transmission steeply and cost effectively. I'll now hand over to Dorothy to lead today's webinar. Thank you.
Thank you, Ariel. Rotary Malaria Partners is honored to present today's webinar. The mission of Rotary Malaria Partners is to ignite an international Rotarian campaign for the global eradication of malaria. In addition to its Rotary advocacy work, Rotary Malaria Partners is in various stages of training and equipping over 1,700 malaria preventative CHWs in Zambia and Uganda, in conjunction with their respective ministries of health. RMP is also supporting malaria public education in the Gambia and indoor residual spraying in Ghana, among other efforts. Today's webinar is entitled Malaria's Growing Financial Dilemma, and our speakers today, in alphabetical order, include Dr. Kenneth Staley, the Global Malaria Coordinator with the President's Malaria Initiative, Dr. Keziah Malm, Program Manager of the Ghana National Malaria Control Program, and Peter Sands, the Executive Director of the Global Fund. Dr. Ken Staley was appointed to lead the USAID COVID-19 Task Force in March 2020. He joined USAID in April 2018 to lead the US President's Malaria Initiative, a collaborative US government effort led by USAID in conjunction with the Centers for Disease Control and Prevention, the Department of State, the White House, and others. Prior to this appointment, Dr. Staley was a consultant at McKinsey & Company, where he assisted with large public health crisis responses to Ebola and Middle Eastern respiratory syndrome, and served clients in the pharmaceutical and medical device industries. Dr. Staley received his MD from the University of Iowa's Carver College of Medicine. He also holds a Master of Public Administration from the Harvard Kennedy School and a BA in Biology from Washington University in St. Louis. Dr. Keziah Malm is the Program Manager of the National Malaria Control Program, Ghana Health Service. A public health physician specialized in epidemiology with a distinguished career in malaria, Dr. Malm earned her medical degree from the University of Ghana Medical School. She then pursued a master's in public health at the University of Ghana School of Public Health and subsequently gained her doctorate in public health. She was the first woman to be trained at the Ghana Field Epidemiology and Laboratory Training Program. As the program manager, Dr. Malm leads the strategic direction and planning for all malaria control interventions in Ghana. Under her able leadership of the program for the last 3 years, malaria deaths in the country have declined by 599 in 2017 to 333 in 2019, representing a 44% reduction. An author of several articles in public health and disease control, Dr. Malm has been instrumental in the development of national guidelines and plans for malaria control in the African region. Peter Sands has been the Executive Director of the Global Fund to fight AIDS, tuberculosis, and malaria since March 2018. Since June of 2015, Peter has been a research fellow at Harvard University, dividing his time between the Masavar Ramani Center for Business and Government at Harvard Kennedy School and the Harvard Global Health Institute. Peter was Group CEO of Standard Chartered plc from November 2006 to June 2015, having joined the board of Standard Chartered as Group CFO in May 2002. Prior to joining Standard Chartered, Peter was a senior partner at McKinsey & Company. Peter graduated from Oxford University with a first-class degree in politics, philosophy, and economics. He also received a Master in Public Administration from Harvard University, where he was a Harkness Fellow. I'll now hand over to our distinguished speakers to open our conversation today.
This is Peter Sands, Executive Director of the Global Fund. For those of you who aren't familiar with the Global Fund was created in 2002, very much in response to the HIV pandemic. It was a constellation of people like Kofi Annan, George W. Bush, Jacques Chirac, Bill Gates, who came together and actually then created something which was designed to fight not just HIV, but the three biggest infectious diseases affecting humanity: HIV, tuberculosis, and malaria. And right from the start, the Global Fund was conceived as an organization that was not just top-down, but country-led, that was not just public sector, but deeply involving civil society, communities affected by the diseases, and the private sector. The Global Fund now provides 56% of all international financing for malaria programs. That means about 37% of total available financial resources for malaria. In fact, I think between Ken Staley and I, we have organizations which control about 3/4 of all international financing of malaria programs. And the story of the fight against malaria since the early 2000s is actually a story of great success. In the countries where the Global Fund invests, malaria deaths have dropped by 46% in that period. And in fact, given population growth, if the incidence had stayed the same, deaths increased by something like 65%. We do this through partnership with national malaria programs, with PMI, with communities affected by the disease, with the private sector. The Global Fund is actually stepping up its fight against malaria. We work on a 3-year grant cycle, and in the next 3-year grant cycle, which starts in January 2021, we will be increasing our malaria grants by over 23%. That means we will be spending something like $1.5 billion a year on malaria. As I said, this is all done in partnership particularly with PMI as the other very large funder, partnership with the national malaria programs, partnership also with technical providers and coalitions such as the Rollback Malaria Coalition, and of course, RMP. The challenge we now have, however, is that COVID is disrupting everything in the more vulnerable, poorer countries in which malaria is so rampant. And indeed, even before malaria, even before COVID emerged, we were seeing an increasing divergence between one set of countries which we were making very rapid progress in eliminating malaria, and another set of higher burden countries where we were making progress every year in reducing the number of deaths, but actually going somewhat backwards in terms of the number of cases. And so we were already facing a significant challenge, which was why we had called upon donors to step up the fight and why we secured more resources. But COVID makes this all much more difficult. It overwhelms and disrupts and diverts attention within health systems. Community health workers who are vital to playing a role in fighting malaria are now being used to do contact tracing for COVID, but also very, very exposed to COVID themselves, given the nature of the role they play. The bednet campaigns and indoor residual spraying campaigns that play such a vital role in vector control are more difficult to implement if you're trying to do social distancing and lockdowns. Actually, the malaria community has responded incredibly rapidly to finding ways to adapt such programs so that they can continue to happen. And we've also seen diversion of manufacturing capacity from diagnostics from malaria to diagnostics for COVID. The problem and the underlying challenge with malaria is that it's a very unforgiving disease to fight. It's responsive when you attack it hard and you have a concerted approach towards case management, towards vector control, and you work very aggressively. You can beat this disease. It's been proven again and again and again. You can beat this disease. You can completely eliminate it. But what's also been proven again and again is that if you give it a chance to come back, it will come back with a vengeance, and it'll come back extremely rapidly. And the real challenge we face right now is that with the disruption being caused by COVID, is that we're giving malaria that chance. We're giving it a chance to come back at scale in the places that are most vulnerable. And that's why we face this financing challenge. And also, we face financing challenge because in the countries most affected, the economies have been severely disrupted by COVID. And so the domestic financing for malaria, in some places at least, has come under pressure. And so this is why it's great to have this opportunity to talk with the Rotary. We already, through RMP and the Rotary Australia World Community Service, have worked with the Rotary family. But seeing the way and the role you have played on polio and the extraordinary commitment and dedication that Rotary participants have shown in that, I think there's something we can learn from and draw on as we face this really critical time in the fight against malaria. So I'll stop there and hand over to the next of our panelists.
Well, first of all, thanks to everybody for attending today, and Dorothy, thank you very much for the kind introduction. Let me first give folks a brief history of PMI. Some of my comments, I think, will add to what Peter has already talked about. As you heard from Peter, the Global Fund was created in 2002. It's a mechanism for financing the fight against the world's three biggest killers: HIV, malaria, and TB. For us, as the US government, we are the single largest funder to the Global Fund. But as Peter mentioned, together, PMI and the Global Fund really are the bulk of malaria funding around the world. And that leads to approximately $2 billion annually to malaria efforts globally. As Peter mentioned, in 2002, the Global Fund was created. In 2005, President Bush launched the US President's Malaria Initiative. The goal at that time was to reduce malaria deaths by 50% across 15 high-burden countries in sub-Saharan Africa. PMI is led by the United States Agency for International Development, and it's co-implemented with the US Centers for Disease Control, and really is a whole of government approach. Thanks to the bipartisan support of the American people and our Congress, over time, PMI has actually increased our annual appropriation for malaria programs around the world, which has allowed PMI to expand now to 24 countries in sub-Saharan Africa and 3 in the greater Mekong subregion of Southeast Asia. When we began operations in 2006, we had a budget of approximately $30 million. That's grown now to a 2019 budget of approximately $729 million to fight malaria each year. So I think What I'd like to talk about is the dramatic impact that we've been able to have. Since 2006, in countries where we work, we've been able to substantially reduce the amount of disease and significantly reduce deaths from malaria. In the year 2000, 1 million people a year were dying from malaria. Today, we've cut that number in half. In the countries where we work with the Global Fund, we've seen a 27% decline in malaria case rates and a 60% decline in malaria death rates since PMI began operations. And that's all while the total population in these countries has increased on average by about 35%. That means that we've been able to do more with less per person over the last 15 years. And I think it's a remarkable success story. Today, if a child contracts malaria anywhere in the world, they have a better chance of being accurately diagnosed, receiving effective treatment, and fully recovering. And they have a better chance of that than at any other time in history. From the US's perspective, PMI has been one of the US government's greatest development success stories. As Peter mentioned, though, COVID has placed an extraordinary strain on our abilities to execute. We, I think, thankfully have adapted our programs very effectively. We've pushed money out into the field and worked with our partners very aggressively to make sure that care can be delivered. But I think there are challenges, and it's important for us to recognize how we've been effective so far and how we can be effective moving forward. What's made our progress possible? I think many of you are intimately familiar with malaria, but I like to simplify. Malaria lives in two places. It lives in mosquitoes, and when people are infected, it lives in people. So we have two missions at PMI. We're trying to make sure that we can kill mosquitoes, and we're also trying to make sure that we can treat people when they're infected or prevent them from being infected. So to kill mosquitoes, we use insecticide-treated nets, and we do indoor residual spraying in many of the countries where we work. And in each of the countries we work, we treat people with accurate diagnosis and prompt treatment with chemoprophylaxis, a fancy word for essentially providing drugs to prevent infection, both for pregnant women and for children. These are cheap interventions and they work. They save lives, they improve education, they improve economies. But at the end of the day, it's at the level of the individual where all of these interventions really take effect. The creation of PMI marked a turning point in the global fight. But it's the partnerships, I think, that PMI and the Global Fund have, along with our National Malaria Control Program partners, where we do joint strategic planning, and with foundations like the Gates Foundation, with private sector partners, and community and faith organizations, and our implementing partners, where that vision has really been turned into a reality. We're trying to bring new partners to the table now, including philanthropic organizations, because they are the key partners when it comes to strengthening local capacities and fostering resilient societies. At the end of the day, our interventions only work if people use them and they seek care. Our effectiveness is about individuals making individual choices and communities being involved. Rotary likes to say it's a network of neighbors, friends, leaders, and problem solvers. And ultimately, that's what our malaria eradication needs to be successful. And that's why we are so grateful for our partnership with Rotarians. The Herculean work to eradicate polio worldwide has been led by Rotary International since 1985. And as all of you know, decades of hard work now has led to the elimination of wild polio transmission from 47 African nations. We are incredibly grateful for the same type of work by Rotarians with recent collaborations between PMI, the Global Fund, and Rotary. The Ministry of Health of Uganda and the Ministry of Health of Zambia are both great examples, I think, to shine a light on. I want to give a huge congratulations to Rotarians in Zambia. They recently received news of a $1 million grant from the Rotary Foundation to continue to expand their training work for community health workers in Zambia's Copperbelt province, which is where PMI works as well. Let me turn to Dorothy actually now to speak a little bit about how Rotarians and PMI are working together in Uganda.
Thanks, Ken. Yeah, we have a project in the northeast of Uganda that's in a very highly burdened area. So typical of the need in these high burden countries. It's very rural, very low resource, and malaria rates at baseline were around 60%. So we have been working on a project where first we reduced malaria infections using some of these interventions that you have here on this slide. Indoor residual spraying and treatment with effective antimalarials. And then we've been doing a follow-up project together with PMI to look at which different kinds of case management interventions do the best job at holding down the burden and also increasing coverage and access. Yeah, and it's been a privilege to work with PMI and with Rotary on this project.
Thanks, Dorothy. And I'll say again, I think it's just been a fantastic partnership to date. You know, Peter mentioned the fact that we can make progress against malaria, but it's a very unforgiving disease. I like to think of malaria as a fire. We have fought this fire very aggressively for the last 15 years, and we've been very successful. But just like any other fire, if we aren't continually fighting it and trying to put it out, it will come back with a vengeance. And I think the COVID-19 pandemic has been another stress on our fight. And frankly, we're at a turning point. We're at a unique point in human history with this disease. It's one that fills me with optimism because I think we can eradicate malaria within our lifetimes. Globally, there's a greater percentage of people who are protected from malaria than ever before. But we can't stop. It's time to redouble our efforts. And that's going to take work at the level of individuals, at the level of communities, and at the level of governments, both local, national, and international organizations. And partnering with Rotary, I think, is a critical way for us to make sure that we do have a malaria-free world in the future. So Dorothy, thanks very much. I'll pass it back to you.
Thank you very much and good day to everybody. Thank you for the organizers and the opportunity for me to share a bit of the story in terms of from the program perspective. So basically, as we know, national malaria control programs are the mandated organizations in the various countries who lead the policy direction and the implementation of malaria control efforts. So Ghana is no different, and our mission is to ensure that we have a population which is free of malaria in our countries. Currently, our goal as the National Malaria Control Program under the Ghana Health Service, which is the implementing agency of the Ministry of Health, is to reduce malaria mortality by 90%, reduce the malaria case incidence by 50% or by 2025, and also aim at bringing at least 6 districts to the pre-elimination level by 2025. And we do this recognizing the role that partners play in country. So I'm talking about partners in country, out of the country. I'm talking about our donor partners, our technical partners, our academia, and NGOs who we work with. Over the years, the work that we've done together has brought us to the level that we are. Just to mention how we work with partners. Generally, I think Dr. Staley mentioned that one of the first things we do in working with partners is developing the strategic plan. And we have partners around the table to make the input. So once the plan is developed, that guides the country's control efforts. For donors like Global Fund, PMI, we go on doing what we call proposal writing. We have operational planning meetings, negotiation meetings to come to an agreement on what these funds can be used, all in line with the strategic plan. And in country, we have several committees. Usually, these committees are aligned towards the intervention that we have. And we have stakeholders in country, sometimes even external stakeholders who are very interested in the areas that we are talking about, sitting on these committees. We meet regularly and we discuss, and it becomes as an advice to the program in its implementation efforts. And we continuously work with our implementing agencies, close joint supervision, monitoring, training, agreeing on key operational issues so that we all move together as well. And then with partners like Rotary, who are coming in all the time, we do one-on-one engagement to get them to understand where the country is, where the gaps are, and how they can fill. And recently in Ghana, we tried to increase the partnership further by trying to form a private-public partnership. And we are trying to do that to increase the domestic resource mobilization. And it's something that we are working on to be able to establish. We started, it didn't give us exactly what we're looking out for, but we've gone back to the table and we hope that will also even strengthen the partnership that we have in country. With all these efforts, I think Peter mentioned the gains that we've made. I think Dr. Staley also mentioned it in terms of the reduction in malaria deaths and malaria incidents. Yes, we have come far in Ghana, even though we are a member of the High Burden, High Impact Initiative. We have made some progress. These pictures are showing the partnerships that we have in country. And I think Dorothy mentioned the partnership with Rotarians, where we did some spraying in one community in the Ghana. We're happy to get that. Basically, just to show that we have several partnerships, and partnerships are very important. So now we go to the slide that shows how far we've come. And so just to show that we have, yes, you can see the map of Ghana, where over the years, malaria prevalence have decreased from 2011 to 2019. We've about half the malaria prevalence that we see in children under 5. And it's all because of the efforts we've all put in to ensure that we scale up proven interventions that work. Deaths have come down. We still, however, have very high numbers of malaria, and the threat is real. We have seen in the past where resources are withdrawn and brings malaria back with a vengeance. So I like the description that Peter and Kenneth said. One said, it's like a fire. Next slide, yes. So this Cohen et al. Showed that in other African countries, Kenya, Nigeria, Sudan, when the resources were taken off, we got malaria bouncing back sometimes to higher levels than we were before. And COVID puts us at a risk. Not just COVID, the general economic trends in the world puts us at a risk of going back to the previous trend, and we can't let that happen. The map on the right shows the situation that we expect in Ghana if we take away the resources. You realize that the blue part of the graph shows getting to numbers more than double what we have now. If we are able to increase resources, strengthen whatever we have to make sure that there's scale up, there's more use, there is the likelihood that we can eliminate malaria by 2030. So the threat is real. That is why I'm happy to hear that Rotary is organizing this webinar, and that the interest in malaria is becoming more and more. So we are hopeful that with more effort, more partnership, more strength, we will be able to win the fight against malaria, COVID, or other diseases should rather strengthen our efforts towards malaria. And in conclusion, greater partnerships are needed to sustain the gains that we've made and even make greater gains. I believe Rotary can work with us through a number of channels at the global level, increase the advocacy, continue the work with PMI and Global Fund to make more resources available and make sure that malaria still remains high on the global agenda. Not just at the global level, but at the national agenda of the various countries that we find the local Rotary clubs. And also work with the malaria control programs, work with the NGOs to fill identified gaps in the country so that together we can win the fight against malaria. Thank you. I do hand over back to you, Dorothy.
Thank you very much. A huge thank you to all the panelists for their remarks. I'd love to follow up with a few questions for everyone. Peter, the Global Fund was created in 2002 to raise funds and invest in the responses to 3 of the world's deadliest infectious diseases. Can you share some of the key takeaways on the partnership's progress against malaria, as Ken did for PMI? And then maybe comment further on the current impact of COVID-19 financially and in terms of disease burden on the malaria program.
Many thanks, Dorothy. First of all, I think it's worth just reinforcing the point that Ken made. It wasn't too long ago that 1 million people a year were dying of malaria. And 2/3 of the people who die of malaria are children under the age of 5. Now, we have brought that down collectively. The partnerships here represented here and the many other national malaria programs and civil society and people involved around the world have brought it down to under 500,000. But that's still a lot of people dying of malaria. And also the morbidity, the non-fatal costs of malaria should not be underestimated. In the high burden areas, you'll have children who catch malaria a couple of times a year. Each time they catch it, they may be treated and recover, but they lose time out of school. You also have something like 11 million pregnant women in sub-Saharan Africa who get affected every year, and that results in nearly 900,000 babies born with low birth weights. So although we have made collectively dramatic progress, we still have some ways to go to put out the fire, to build on Ken's analogy. The progress has been significant. The overlap of PMI countries and Global Fund countries means our numbers are slightly different, but to all intents and purposes, what you have seen is a very significant, roughly half, deaths roughly halved, and then a significant reduction in cases, although as I mentioned earlier, in the highest burden countries in the world, and these are mainly in Africa, we have seen in recent years a flattening of the curve on cases, which is disconcerting and also reflects the fact that actually per capita spend on malaria across the world has actually fallen in recent years. I think to understand the impact of COVID on malaria, you have to understand a couple of things about how you fight it. One aspect of how you fight malaria is that a mosquito in its roughly 2-week-old life has to both bite a human that's infected with malaria and bite another human who doesn't have malaria in order to continue to propagate the epidemic. And the whole trick, as Ken said, is to stop them biting and to kill them. And if you can do that effectively enough, you can break that cycle of transmission. The other critical aspect is, particularly with children, is about speed of diagnosis and treatment. Children deteriorate pretty rapidly, small children, when they get affected by malaria. And it's all about ensuring that they get a child with a fever, gets brought into a community health worker, gets diagnosed quickly, and gets treated. Now, the problem we've faced with COVID is COVID has disrupted all of that. We have resources being diverted, supply chains being diverted, community health workers being asked to do different things, doctors with other priorities, all perfectly sensible imperatives given the scale of the challenge from COVID. But it has been challenging for national malaria control leaders like Dr. Keziah to actually sort of keep the resources focused on malaria. And that's why it has taken the malaria community, and I actually think the malaria community has responded extremely well, enormous amount of effort to say, okay, how are we going to make sure that we continue the efficacy of our vector control initiatives? How are we going to ensure that we do diagnose and treat particularly children really quickly, so we save them from dying? But that takes more resource. I mean, the reality is it costs more money to do that, and so that has been the challenge. I'd also say, and this is Dr. Keziah emphasized this point, is that most of the countries in which malaria is there's a high burden of malaria, have seen dramatic impact on their economies. And so their ability to finance their share of the fight against malaria has had a huge hole put into it. And certainly as we look forward, that is a big source of concern for us. What happens in some countries is that there's a division of responsibility. The Global Fund will take responsibility for financing malaria commodities for one part of the country, PMI will take another, and the national government will take another. And in some of these places, I suspect the national governments there will be a very difficult discussion between people in the doctor's position running the national malaria program and between the finance ministries and so on, because the tax revenues will be far, far less. And that is the reality of the situation they're facing. And so we are going to have to come together, and we're really going to have to focus on how we squeeze the maximum impact from every dollar spent, how we find some more dollars, and how we continue to make progress. Because like a fire, malaria is one of those things where there's no middle ground. You're either putting it out and you're making progress to putting it out, or it's burning more fiercely. There really is no middle ground with malaria. And we're right at that point where we need to make sure we continue that we're putting it out. Thank you.
Thank you. Very well put. Before we move to Dr. Keziah and hear more about the specific challenges that Ghana is facing along the lines that you're both mentioning, Ken, is there anything that you want to add about how PMI and Global Fund work together with NMCPs to address malaria control? I think Dr. Keziah told us a little bit about their partnership strategy, but we'd love to hear from you as well.
Well, Dr. Keziah mentioned that each year there's a planning process where all of us come together and sit around the table. It's led by Dr. Keziah and other National Malaria Control Program leaders in each country. I think that meeting is representative really of how we've tried to think about success over time fighting malaria. So Dr. Keziah, you had a fantastic map that showed progression over time of malaria prevalence, and you showed that it was decreasing over time. I think the point of that slide is it is a long fight, and each change, each time you're seeing progress, it's the result of a lot of decisions in thinking about how we can modify our programming. So when it comes to COVID, one of the things that we try to do in every country where we work is distribute insecticide treated nets. Now, most of the time when we're doing that, we bring insecticide treated nets to a common gathering place and ask everyone from surrounding communities to come to that place. Well, that's exactly the opposite of what you want to do right now with COVID. And so we've worked with national malaria control programs and the Global Fund to change the way we're doing that. We're now going door to door distributing nets. That's quite effective, but it's also more expensive. And so that's a microcosm, I think, of the types of planning that we all do together, the changes we've been making, and ways we've been able to adapt, albeit at a higher cost. I think another example that's worth mentioning here is the way in which the entire community has shifted the way in which we're thinking about communicating with individuals who might be sick. So fever is one of the principal signs of malaria. Fever is also one of the principal signs of COVID. Many people early on in the COVID pandemic were saying, if you have a fever, don't come to healthcare facilities. That's exactly the opposite of what we want to have happen when someone may have malaria. And so the community came together, National Malaria Control Programs, Peter's folks at the Global Fund, PMI, WHO. We created a set of consensus guidelines that we were able to distribute to help all of the community health workers out there, the people working in health facilities, understand how we could deal with fever as both a presentation sign for COVID and for malaria. Again, an example of the way we all work together to try to address whatever challenge comes up. In the case of COVID, there's more expense associated with it, and there are more challenges. So I'll close quickly, but I can't probably say it quite as eloquently as Peter did, but I want to say that I share his sentiment. I think we are at a point where we've made tremendous progress, and we'll either continue making progress or we'll ratchet it back. There is no middle ground. So we have an opportunity as a world, I think, really to double down right now and to make it a reality to be a malaria-free world in our generation. And it's possible, but it will require additional commitment from folks.
Thank you, Ken. Dr. Keziah, we'd love to turn to you and ask you to talk a little bit about the need that you see from the in-country level for advocacy efforts around malaria, for engagement from local Rotarians, what you'd love to see, and then a little bit about what you've been doing to promote greater community involvement in malaria prevention and treatment through the Health Promotion Division, and maybe how you envisage Rotarians helping with Ghana's needs.
Thank you once again. Just some of the things that I'm going to say might have been said by the other panelists, but I think for a malaria program, usually one of our key challenges has to do with funding. So we are quite grateful to the funding we get from Global Fund, PMI, and other partners. So things like diseases like COVID coming up even puts more constraints on the funding that we have, because of the channeling of the funding, country funding to these diseases. And there is therefore the need for us to be able to see how best we can increase or make sure we don't lose the funding that we've been getting to be able to get this far. I think the other challenge also has to do with human resource, getting the right numbers and getting the right quality. And I mean, COVID was even a greater strain, and it is still a greater strain. I do remember some of us being called to now support in the fight against COVID, right from the malaria program to the health facility where the nurses have to now focus on COVID. The risk that puts us is that we will miss malaria. People would stay at home for a longer time till they get to the very late stage before they present. That's why this irony of fever, stay at home, fever, come early so that we treat you in terms of COVID and malaria was a challenge. And being able to coin the message so that you don't put people at risk by not letting them unnecessarily come into the health facility, but also catching malaria early was such a key thing. So I think the other big challenge is getting people to change their behavior, to use the food as a what we've made available to them to make the impact, because even what we've made available to them does work. And if we are able to get people to sleep in the nets, to open their doors for indoor residual spraying, to make sure if they are tested, to be sure it's malaria, to make sure if they are taking the medicine, they take the full course. If we get people to adhere to these ones, even with existing resources, we'll be able to get far. So the nuances around getting people to do that is a key thing that I think it's always helpful for partners to help us look at to be able to resolve. So I think I mentioned earlier on in my presentation on how Rotarians can help us. And it's key in terms of advocacy. I think most of the Rotarians sit in positions where their voices can be heard once they start talking about the risk we face if we don't continue to even increase the support and the effort we are putting in place to fight malaria. We tend to put ourselves in position that will cost us more if we don't improve what we are doing. So it's very important that in-country, national level advocacy for increased resources and the focus on malaria as we still continue to fight the other diseases. I think one of the things that is also helpful is focusing on building health systems, because malaria is a disease that works in the control works in the health system. So once the health system is strengthened, it helps in the control of malaria. So it's also important we look at that. For the community participation, I think one of the key areas has to do with getting people to change their behavior. So if we can get the community to understand the need for them to do one thing or the other, and empower them to be able to do that, I think we'll be moving in the right direction in the fight against malaria. There were other challenges around timing of interventions, how we do it because of COVID, and we've learned. My hope is that as we go forward, what we've learned from the fight against COVID, we'll be able to bring it to bear in the fight against malaria and other key diseases, so that we can quickly eradicate, just like we are fighting to quickly get COVID up, we can quickly eradicate malaria from the world. But Dorothy.
Thank you. Yeah, that report from the middle of the firefight is totally invaluable, and it sounds as though you see a large role for Rotarians in country, in advocacy, in education, in behavior change communication, and also in building this all-important momentum that you're talking about so that we can eradicate quickly. Just to pivot back to Peter and Ken, I'd like to also ask both of you, maybe first Peter, then Ken, very briefly, so that because our time is constrained, just to comment on how you envisage Rotarians working together with the Global Fund and with PMI at this pivotal moment that you've so well articulated, all three of you.
Just very briefly, first, I think Rotarians have demonstrated with polio and in our partnership, certainly since 2018 with the Rotary family, we've seen it ourselves, fantastic ability to keep malaria on the radar screen. And that's incredibly important right now. It would be a cruel irony if COVID, which is a disease that actually doesn't really threaten children much, ends up killing a lot of children because of the impact it has on malaria. So keeping it on the radar screen. Secondly, I think one of the things you've demonstrated in the Rotary Network with polio is that you can win battles against a disease. You can actually get rid of it. And we know that this is a disease that 6 countries have been declared malaria-free since 2016. There are another 15 countries that are on the cusp of it. We can win against this disease. And again, the voice of the experience of the polio story, I think, is very powerful. And then finally, just building on Dr. Keziah's point about communities and community leadership, what I've seen from the Rotarian family is the ability to connect with and mobilize communities, both at a global level and at a local level. And that's incredibly powerful for resource mobilization, for behavioral change, for getting people to take the tough political decisions that are involved in eliminating malaria.
Peter, thanks. I'll just try to amplify two of your points. I think there are two levels at which Rotary has tremendous impact. The first is at the level of the individual. So I have a friend who was involved in the polio eradication campaigns in Africa in the 90s. He was often asked to speak to Rotary groups, community-based Rotary groups that actually had an impact on vaccinations and individual behavior. And I think the same can be said when we think about the impact that Rotary groups can have on individual behavior for malaria. Whether that's encouraging mothers to seek treatment for kids with fevers, whether that's encouraging individuals to sleep under insecticide-treated nets, the ability to impact the community, individuals, is unparalleled. I think the other thing that Rotary can do at the national and the global level is make sure that a disease that can be eradicated is kept at the forefront of policymakers' agendas. Rotary's work to advocate to ensure that polio is eradicated from the globe has been unparalleled. And I think there's an opportunity for that same type of help for the fight against malaria.
Dr. Keziah, I would love to give you a last minute to talk just a little bit more, really for only 60 seconds before we go back to Ariel, about how we could, in fact, build on these lessons from COVID-19 and eradicate more quickly.
Yes, so thank you, Dorothy. I think that COVID has taught us even more than ever that we are so connected. Whether you are in Timbuktu or you are in Accra, we are so connected, and that working together as one is the way to be able to fight any disease. And so my take-home message is that partnerships are so important in the fight against malaria. And wherever we find ourselves, Rotary, at the global level, at the national level, at the community level, it's important we all chart a partnership that will lead us to be able to eventually eradicate malaria. I'm happy with the 6 countries, but I'm hoping that the next time we'll be having this talk, the numbers would have increased. And with such a trend, if we continue that and we move it to a higher level, we are likely to be talking about eradication in the next coming few years. Over. Thank you.
Thank you so much. That's a wonderful note. And thank you to all the panelists. Ariel, handing back to you.
Wonderful. So we received a question actually for Dr. Staley from Mulenga Mbita, who's the Chief Health Officer of the Mopani Copper Mines in Zambia, and wanted to know if there's any possibility by the Rotarians to extend interventions of management of mosquito breeding sites, because Mulenga is saying that this is a missing link to the critical to malaria elimination.
It's interesting that question's coming up across a lot of different countries now, whether we should be doing more larval control, essentially looking for standing pots of water, for example, to try to disrupt where mosquitoes breed. I think at PMI, we try to make sure that whatever we do has the most bang for the buck. And so there's a number of different interventions that we've thought about investing in. We try to invest in the ones that we think have the most science behind them. I think larval management, disrupting where mosquitoes are breeding, there are definitely some advocates for it, but at this time, I don't think we have the scientific basis to say that it is a proven intervention that will make a dramatic impact. Now that could change over time, and I think we have a couple of different partnerships right now with different malaria control programs looking at those interventions and seeing the impact they may have, but we don't see the strong science behind it at the moment. speaking very frankly.
Great. And then one final question for everyone. I'm not sure who sent it in, but thank you. As we continue to see dengue, chikungunya, and Zika fevers reemerge in Africa, and COVID-19 continues to inflict a heavy financial and emotional toll on the continent, will the Global Fund, PMI, and RMP support integrated mosquito control and mosquito population suppression tools that went far beyond IRS, indoor residual spraying, and LLINs, and eradicated malaria years ago?
I think when we think about the new treatment, new mosquito control technologies, there are a few on the horizon, especially genetically modified mosquitoes, which may really be game changers. But as with larval management, at least from a PMI perspective, we want to see more science behind it before we ever would try to invest in it at a substantial level. So short answer is we're absolutely interested in mosquito control, but for everything that we do, it's about making sure we have data behind it.
Anyone else on the panel want to answer?
Yeah, I just build on Ken's comments. I mean, I think the challenge we have here is that a couple of things. First is, although there are new tools coming available, and actually the next generation of insecticide impregnated bed nets are looking pretty good as an investment, we need to make sure all the time that we are getting the best bang for the buck, so to speak, because actually the amount of money we're spending per capita on malaria in malaria affected places is extremely small. It's $3 or $4 a person. So we cannot afford to waste a single cent if we are to save lives and make progress. And so that's why doing it in a very evidence-based way is crucial. And we also need to keep in perspective the relative scale of the other threat. The reality is malaria is still killing many, many, many more people than the other vector-borne diseases. So while the investments we make against malaria will have a beneficial effect on other vector-borne diseases, we need to be careful about where we focus our efforts. But these are not, this is easy trade-offs. And also the reality is, if we had enough money to fight malaria properly and really beat it, actually we would do all this stuff in a kind of collateral way anyway. What makes it really difficult is we still have situations where we haven't got adequate bed net coverage across countries, where we're not doing IRS, and where we haven't got the community health workers in place to identify fevers and treat children quickly. And when we're in that situation on the basics in some countries, it's hard to expand the scope at all.
Dr. Malm, did you want to respond to that question?
Yes. So I think it's usually, I mean, on the face, okay to just combine all the vector control efforts because they are probably similar mosquitoes or the same mosquitoes. But I've always said that integration does not necessarily mean adding on. And like Peter said, especially when malaria is still killing a lot of people and we still haven't been able to address the issues, we just have to be tactical if we need to add on and combine, such that it's not just a matter of bringing the challenges in one to add for the stream of resources being used to solve one to address. It will mean properly identifying what can work together better, bringing together resources for managing both diseases to achieve. Otherwise, what happens is you just add on and we even start seeing challenges with what we were originally achieving in terms of malaria control. Also, to comment on the issue of larval source management, I think coming from the program point of view, there's been quite a number of countries expressing the desire to be able to get the mosquito larva even before it becomes an adult. And like it said, it's always been raised as an issue of around data. Unlike ITNs and IRS, where we have a lot of data, we don't seem to have much, so it becomes difficult for donors to be able to accept that. What we are doing in country is that because the government is funding larval source management, we've taken it upon ourselves to be able to provide more robust and scientific data to be able to answer the question, is it really that effective? And I feel that if quite a number of us, if quite a number of companies and partnerships take interest in providing that data, that question can easily be answered, and we'll all feel comfortable as to whether we are going for the string, full force or larval source, or just focusing on the ITAs and the IRS. But it is something worth considering.
Thank you, Dr. Malm. Dorothy, our moderator, would you like to have any final comments?
Thanks, Ariel. And thank you to all the panelists. I thought this was an absolutely wonderful discussion. Just to focus our energy on the fact that this is a turning point and that we always have to be fighting malaria aggressively, because if we're not fighting malaria aggressively, we're losing a lot. And then, Dr. Keziah, your injunction to us to try to eradicate quickly, to try to build that momentum for a truly aggressive fight, which definitely means mobilizing more resources for this battle, because we are underfunded. So we're hearing in this last segment that there are many things countries want to try to do, but that because the dollars are so tight, we have to be incredibly careful about how we spend them. And what's clear is that we need more resources in this battle. We need to treat this like a fight that we want to win. So I'm very excited. I'm very excited by the energy that and dedication and technical expertise that each of you has brought to us. And I'm hopeful that the Rotarian community will be able to rise to this challenge and respond robustly to it. Thank you.
Thank you, Dorothy. And though resourcing is tight, the power of collaboration is very, also noted during this presentation, is also very important. Again, as Dorothy mentioned, I want to thank all of our speakers today for joining us, all of your organizations, and for all of the work that you do. We would love for you to join additional webinars, and if you would like additional information about Rotarian Malaria Partners, we really encourage you to go to our website at rotarianmalariapartners.org, sign up to our newsletter, and other webinars that will be coming in subsequent months. We'd love to hear from you as well. And please note again that I will be compiling all of the questions, and I'm sorry we weren't able to answer all of them during the event today, but we will compile them and ensure that our panelists have an opportunity to answer and get those out on our social media platforms for further viewing. So thank you again.